cloud. Okay, I think we have all the bugs worked out. So, and we certainly have a good number of folks attending. So I just want to say thank you all for being here and good evening. And for those of you who don't know me, my name is Kimberly Connell. I'm the Caregiver Services and Support Specialist with Onondaga County Office for Aging and Long-Term Care Services. So many years ago, long before I came along to the county, the Caregiver Services with the Office of the Aging established the Institute for Caregivers, or iCare classes, to provide free education and training on a variety of topics. We do these every spring and every fall for caregivers, for families and care receivers, and seniors in the community. So in the upcoming month, we have classes on communication, issues with dementia, adaptive technologies for caregivers, and we have a whole slate coming up in the spring. So you should be receiving information about those classes and other future classes. You can always reach out to me if you have any questions or want a list of upcoming classes. But for tonight, I want to welcome you all to the Institute for Caregivers class on Medicare and You in 2022. So this is definitely a hot topic. We have a lot of folks attending the class tonight and a good cross-section of professionals and individuals in the community. So I know whether you're new to Medicare or you're interested in learning what's new in the coming year, or you've had Medicare for many years and you still aren't quite sure what Medicare covers or what A, B, and C does or what it means, then this class is going to help answer your questions so that you can make the right decisions for you or your loved ones in 2022. So to present the class tonight, we have the expert at Onondaga County. We are pleased and privileged to be able to have Taylor Kuzel. I'm sorry, Kuzel. I should have asked you how to pronounce that. Kuzel. Taylor is currently serving as the Services for Aging Specialist at the County Office for Aging and Long-Term Care Services. Taylor earned her master's in public health from Upstate Medical University and with a dual certificate in health service management and policy through Syracuse University. And in her current role with the county, Taylor oversees the Medicare counseling program, as well as the senior shopping program and the neighborhood advisor program. So in her day-to-day activities, Taylor provides Medicare eligible individuals with information and resources they need to decipher what type of Medicare plan will best suit them. And additionally, Taylor is a member of the Elder Justice Committee, the Elder Identity Theft Coalition, and she's a member on the Senior Advisory Council. So now some of you also may have seen Taylor last Saturday on Channel 3 Weekend Morning News Show with Melody Johnson, where she was talking about her role with the county and also this class. Some of you may have already spoken with Taylor, and I suspect if you have not, then you certainly will in the future. So Taylor is a strong advocate for the senior population and looks forward to continuing her efforts to support all seniors in our community. So we are in really good hands tonight, as you can see. So now I think all of you should be muted when you are entering in. You do have the ability to unmute yourself, but we ask that you keep yourself on mute throughout the class. If you have questions that Taylor has not addressed during the class, you can raise your hand or add it to the chat, which I will be monitoring. And both of those options are available on the Zoom dashboard, either at the top or the bottom of your screen. If you're not able to find those, but you also will have the option to unmute yourself and ask a question during Q&A. Closed captioning is also turned on and it's available for anyone who wishes to use it. You can turn it on or off also with the option on your Zoom dashboard under More. There's an option to turn it on and off. And as you already know, it's live streaming to YouTube and this recording will be posted on our website on the Caregiver page once I edit it. And finally, at the end of the class, there's going to be a brief questionnaire that will come up on your screen. So we ask that you complete that if you can. It's really helpful for us. And with that, I am going to turn you over to our presenter. Taylor?
Hi, everyone. So nice to be here. I'm really excited to, get the chance to get out this important information with Medicare open enrollment starting. So I'm going to share my screen. Okay. Is everyone able to see? Perfect.
Yep, looks good.
So as Kimberly mentioned, this program tonight is on Medicare for the upcoming year, as well as general Medicare information. I will preface ahead of time that Medicare can seem overwhelming, and this is a lot of information that we're going to be going through tonight. So we're going to take it step by step. If anyone has any remaining questions afterwards, of course, we will be able to address things one-on-one. With that, I'm going to get started. We'll be looking at really what is Medicare, what's new for the upcoming year. We'll be looking at Medicare Advantage plans versus original Medicare and Medigap plans. Really that big question, how do I pick the right plan for me? And that's something that I will really stress once we get to that part of the presentation. We'll be looking at some income-related savings programs that may help folks who are eligible save money towards different parts of their healthcare insurance. And then I will go over what this high cap counseling program is and really how it can benefit you, a friend, family member, or clients, whatever your role is here tonight. Okay, so the picture on the screen, if you're following along by PowerPoint, and for those of you who are calling in by phone, the picture on the screen right now, it shows a gentleman who sees a big sign at the start of a maze, and it says, "Welcome to Medicare, enroll here." And I can't tell you how many people, you first entering the Medicare world, they call and, I don't know where to start. And you're not alone. I think that's everybody when they start to learn the Medicare system and, just every different aspect of healthcare, insurance, how things do and do not work together. So it really is, it can come off as a maze, but I will say it a million times. We will take things one step at a time and help you from feeling less overwhelmed throughout the process. One of the first questions and topics I want to go over, and a common thing that comes up in conversation is, what is Medicare versus Medicaid? And again, for those of you following along by the PowerPoint, I've highlighted the words care and aid. So Medicare is health care insurance, and whereas Medicaid, it's an aid, it's an assistance. So Medicaid is a state and federal assistance program. So Medicaid, aid, and assistance. So that's how I always remember that. For Medicaid, folks must qualify with low income and limited assets. There's no restrictions with age when it comes to Medicaid, and coverage and eligibility varies state to state, whereas with Medicare is the federal health insurance program for U.S. citizens or legal permanent residents who are 65 and older. What I mean by legal permanent resident is they have been legally a part of the United States for 5 years or longer. Individuals younger than 65 with certain disabilities and who have been receiving Social Security disability for 24 months are automatically enrolled into Medicare. Individuals with end-stage renal disease as well as ALS. And in the bottom right-hand corner of the slide, you will see a sample Medicare insurance card. So in the past, the Medicare cards would have your Social Security number and more private information on there. Where now for Medicare, you have your red, white, and blue card. It has your name. You'll be given an individual Medicare ID. And it's always important to pay attention to the bottom part of the red, white, and blue card. which will list out your hospital Part A insurance and the active date. So that means what day did your coverage start? And it will list out your Medicare medical Part B insurance with that active date as well. So you always want to see both of those there, unless you have other coverage, which we will get to. Okay. So the next big question, how and when do I enroll for Medicare? So don't worry, I put this slide here and at the end. So if you don't catch the phone numbers or information now, I will be giving it to you again. So if you are receiving Social Security benefits when you turn 65 years old, then you're automatically enrolled. So for example, say you start collecting your Social Security at age 63. When a few months before you turn 65, you will receive your card in the mail. You'll be automatically enrolled into Medicare. If you do not receive Social Security benefits, you must enroll starting 3 months before you turn 65. And we will talk about those enrollment periods. And when it comes to enrolling for Medicare Part A and B, always, always, always enroll for Medicare Part A and B through Social Security Administration. And that can be done online or over the phone. They've expanded that online application, especially with COVID, and which has really allowed for more flexibility for their staff, as well as everyone who is trying to receive these benefits. So you can enroll for Part A and B through Social Security Administration. If you wanted to enroll online, that is ssa.gov, or over the phone at 1-800-772-1213. So now to go through the enrollment periods. The initial enrollment period that we look at is referring to the 7 months surrounding your month of eligibility, which really means 3 months before your birthday month, and 3 months after. So if you are turning 65 in June, and you give me a call and you say, okay, I turned 65 next year, I'm going to need to sign up. I'm 65 in June. When can I do that? We're going to say, okay, so March, April, May, that's the 3 months before. June is your birth month. And then July, August, September are the 3 months after. So you have that 7 month period to enroll for Medicare without any penalties. The big enrollment period that we have coming up is open enrollment period, which is every single year from October 15th to December 7th. And this is when you can join, switch, drop a plan, and your coverage will begin on January 1st. So a lot of individuals say, how do I know if I need to make a change? Well, you don't have to make a change every single year, but it's good to really touch base with your provider, and everyone's health needs change over time. So it's good to touch base and see, am I still really receiving the best coverage, and am I paying the most appropriate cost? And you can take a look at that every single year during open enrollment period. Once the beginning of the year hits, that is the general enrollment period, which is when you can make changes to a Medicare Advantage plan. And that is from January 1st to March 31st. That coverage doesn't begin until July 1st. And then there's special enrollment periods, which is a time period when you can sign up for Medicare if you have had a life-changing event. So if you've lost your job, you lost coverage, you got married, so you're getting new coverage, whatever it might be. Anything that's life-changing, you're granted a special enrollment period with no penalties faced against you. just a little graphic looking at the initial enrollment period again. So in the middle, you put in your month, your birthday month that you turned 65. 3 months before you sign up for Medicare Parts A and or B. For example, if you are still employed, sign up for Part A, but if you're employed and you have medical credible coverage through your employer, then you can delay the enrollment for Medicare Part B, and then you would later send in specific forms that basically, essentially says, I had this coverage and this coverage is ending on this date, and you'll be allowed to enroll with Medicare without any of those penalties. So when it comes to first enrolling in your initial enrollment period, so if you enroll 3 months before the month you turn 65, or 2 months before the month you turn 65, your coverage starts the first of your birth month. If you enrolled, say you enrolled the month of your birthday, your coverage won't start until 1 month later. If you enroll the month after your birthday, your coverage will not start until 2 months later. And then if you enroll the third month after your birthday, it's 3 months later. So that's just something to keep in mind as well. If you have other coverage, being mindful of when will that coverage end? Do I have any limits? And if you ever have any questions on if and how this applies to your specific situation, just give us a call and we'll be more than happy to help. All right, so the next big question is what's A, what's B, what's C? What are all these different parts of Medicare? I call this Medicare alphabet soup. There's so many different letters that can just be confusing and overwhelming. So let's take it step by step. The parts of Medicare. So Part A is your hospital insurance. Part B is your medical. Part D, I always remember Part D is your drug coverage. Part D is your prescription drug coverage. And then separately, there is your Medicare, there's the Part C, which is also known as Medicare Advantage plans. Taking a deeper dive into each part, with the Part A hospital insurance, Part A is anything inpatient. So that's your inpatient care into hospitals. And you must be admitted to the hospital. You can't be in the hospital and there for observation. You must be admitted. So that's always an important question to ask, if you're in the hospital or if someone you know, or just in any type of situation, insurance-wise, am I admitted or am I here for observation? Because that's going to impact how a bill is going to be covered. Part A hospital insurance also covers skilled nursing care facilities after a 3-day hospital stay. So I get this question a lot. Does Medicare cover nursing homes? No, Medicare doesn't cover nursing homes. It doesn't cover, you have to have a 3-day hospital stay, and you cannot be in need of custodial care, which means bathing, toileting, showering, eating. Part A also can cover hospice care and, with exception, home care. So with the home care, Medicare will cover home care after a hospital stay, after short-term rehab, but only for a set period of time, and it has to be with a certified Medicare approved home health agency. And we'll take a deeper dive into Medicare and home health care a little bit later in the presentation. Part B, medical insurance, is everything outpatient. So outpatient care is Part B. So this looks at your services from doctors, other healthcare providers, Part B can cover durable medical equipment, x-rays, labs, ambulatory services. It can provide you coverage towards physical or occupational therapy, as well as some preventative services such as mammogram screenings, certain vaccines, and your yearly wellness visit. With the Medicare Part B, you usually pay 20% of the Medicare approved amount. For example, your bill is $100, Medicare will pay 80% of that, and you will pay the remaining 20%. Now, looking at the cost with Part A is usually free. If you have worked, they say 40 quarters, essentially, if you have worked 10 years of your life, you receive premium free Part A. If you have not put in those 40 quarters of work history in the US, you usually have to buy in at the rate is premium rate is between $259 to $471 a month for that monthly premium. The Part B monthly premium for 2021, the standard premium, which most folks in the US are paying the standard premium of $148.50. The Part B premium is expected to go up about $10 for 2022. So, and that's nothing that's been set in stone yet, but anticipating it to be about $158 for 2022. If you enroll late into Medicare, there is a penalty. So if you enroll into Part A and B, A and or B late, you will be placed with a premium increase of 10%. So that's why it's so important to pay attention to those enrollment periods. And I will open doors, call me, email me if you have questions on when am I supposed to enroll, because it's better to ask the question and not, maybe you don't have to enroll for another year or whatever it is, but at least so that way you're not faced with that extravagant, the huge premium cost. Something I want to make sure we go over as well is what Medicare Part A and B does not cover. So Medicare Part A and B does not cover your prescription drugs. It does not cover over-the-counter medications. It does not cover long-term care, dental, dentures, vision, cosmetic surgeries, acupuncture, hearing aids, exams for fitting the hearing aids, or routine foot care and podiatry services. I'll never forget sitting in my grad school class and my professor, we're going over everything with Medicare, and I'll never forget him saying, what is the one thing that somebody, aging or 65 and older, what is one thing that it's anticipated that they might need one of these services? And I remember him saying dental, vision, hearing, and it's one of those things that kind of makes you scratch your head, but so now we're going to take a look at original Medicare versus Medicare Advantage plans. So Medicare with original Medicare, that includes parts A and B. So your hospital and your medical insurance, so inpatient and outpatient care. With original Medicare, you can join a separate Part D. Remember, Part D is drug, Part D is your prescription plan. So with original Medicare, you can join that separate drug plan. With original Medicare, you have that ability to use any doctor or hospital in the US, really anywhere that accepts Medicare. You don't need a referral to see a specialist with original Medicare. There's no yearly limit on out-of-pocket costs. And with original Medicare, you can add a Medigap supplement plan to help you pay some of those out-of-pocket costs. So for example, that extra 20% co-insurance that you might be faced with. And we will get into more of the details of what a Medigap supplement insurance is. So we will go over that as well. Something that you might receive with a Medicare bill or Medicare mailings is something called a Medicare summary notice. So I've highlighted and bolded the word notice. So Medicare summary notice, it's something that you may get in the mail related to your Medicare, but it is not a bill. It is simply just a notice that summarizes any services or supplies that have been billed to Medicare Parts A and B they do it quarterly, so every 3 months. So the Medicare summary notice every 3 months shows you what Medicare paid. And if you did owe anything to a provider, it may give you an estimate of the maximum amount you may owe. But again, a Medicare summary notice is not a bill. You do not need to pay anything when you receive one of these. It's just a notice telling you what was provided over that quarter, over that 3 months. If you didn't get any services or any supplies, you will not receive a Medicare summary notice during that 3-month period. Okay. So now let's take a look at Medigap supplement insurance. So in this one, I highlighted in the word Medigap, I highlighted gap, made it a little bit bigger because Medigap is really, it's that supplement insurance that helps you cover the gaps within Medicare. A Medigap plan can help you pay out-of-pocket costs not covered by original Medicare, such as co-payments, co-insurance, deductibles. And Medigap does not cover drugs. So you still need a drug plan. You still need prescription drug coverage. Medigap does not cover your prescription drugs. Something to also be aware of is that you must have Medicare Parts A and B, and you can use Medigap with any provider in the US who accepts Medicare. A lot of questions come up as well is, I have a pre-existing condition. Will I have a waiting period? Well, it depends, but possibly, yes, some folks will have a waiting period of up to 6 months. But if that is a concern of yours, if you've identified a Medigap plan that you want to sign up with, you can either contact that insurance company, or you can give me a call and we'll look into it together. So I've put a chart up here on the different Medigap supplement insurance plans. So for a second, just wipe out any of the other letters that we've gone over in your head for a second. So these A, B, C, D, these are not the same plans that we just went over. So these A, B, C, D, F, G, L, M, N, these are all just strictly for Medigap plans. And you hear me use Medigap and supplement insurance interchangeably. It is the same thing. Medigap is supplement insurance. So with the different plans, they offer different types and different levels of coverage. For the folks who turned 65 after January 2021, you cannot get plans C or plans F. And even in a meeting recently with my colleagues around the state and with the New York State Office for Aging, we talked about how most folks sign up for the Medigap Plan G. And that doesn't mean that it's necessarily the best option for everyone, But Plan G is really the most comprehensive to folks who are new to Medicare, just turning 65. And it offers you coverage towards your Part A hospital coinsurance, your Part A hospice coinsurance, your Part A deductible. It can give you coverage towards your Medicare Part B co-payments and co-insurances. If you were ever in need of any blood transfusions, it would assist you with the first 3 pints of blood, as well as Part B excess charges. And not that many people are traveling outside of the country right now, but it can give you coverage towards foreign travel emergency up to 80% coverage. Okay, so now I know we're going fast, and I acknowledge that it is a lot of information in a little bit of time, but I do offer that one-on-one support, and I do encourage it. So with the Medicare Advantage plans are private Medicare approved plans that usually have a combination of Medicare Parts A, B, and D. So Medicare Advantage plans, it has your hospital, it has your medical. So no matter what, you're going to have that Medicare Part B premium of $148.50, unless of course you qualify for certain income related savings programs. So Medicare Advantage plans, again, this is referred to as Part C. It's includes your hospital, your medical, and most of them include your Part D, your drug coverage, and some may offer extra benefits like dental, vision, and hearing. I know for those of you who I've worked with in the past, or if I've recently helped you pick out and go through different plans, I automatically am going to sort them out and only look at Advantage plans that offer you drug coverage. But if that's not something that's your goal with your coverage at this time, I will do what works best for you. But with Advantage plans, you need to make sure that you're using a doctor that is in that Advantage plans network. For example, some of the insurance carriers in Onondaga County are Excelis, United Healthcare, there's Aetna. There were several different Advantage plans carriers. So you need to make sure that whatever Advantage plan you go with, your doctors accept that. Some medical websites actually have the list of providers accepted right on their page. But you can always just call them and ask a doctor's office if they accept XYZ. With Medicare Advantage plans, you will likely need referrals to see specialists. You may have lower out-of-pocket costs, and there are yearly limits on out-of-pocket costs where there is not with original Medicare. And with the big thing with Medicare Advantage plans is you cannot and you do not need a Medigap supplement plan. So you can't have it. You don't need it. Medicare won't allow you to do that combination. So Medigap supplement only goes with original Medicare and Part D. And with Medicare Advantage plans, you only have Part C. That's it. You only have the Medicare Advantage plan. Okay, so now taking a look at Medicare and home care. So Medicare covers your home health care if you're homebound. So this means homebound means that you essentially have trouble leaving the home without help. We are seeing such an increase in need for home health care, but as some of you may have experienced, and I know some of my colleagues who might be in the program right now have also experienced, there's just a huge shortage with home health aides right now, and we're all doing what we can to help, and it's a tough situation, but Medicare, it's tough to get that Medicare and home health care coverage. A person must need skilled nursing services, and that your doctor must confirm and that it's medically necessary. And then once the doctor makes that confirmation and fills out the appropriate forms, your primary care doctor will be able to send that essentially referral or prescription to the certified home health care agency that you have identified. And you might hear those referred to as CHAs. So if you are looking for Medicare to cover, you have to follow under these guidelines, and you have to work with a Medicare certified home health care agency. And I will put a quick plug out there for our New York Connects department, who, if you are looking for information on different types of care options, what's in Onondaga County, whether it's skilled nursing or home care, our New York Connects department can help folks identify different care options. And New York Connects phone number is 315-435-1400. So to move on with Medicare and home care, what isn't covered? 24-hour-a-day home care is not covered. That's something that you likely would need to pay out of pocket. Medicare does not cover home delivered meals, housekeeping services such as cleaning and laundry, and custodial care like your bathing, dressing, toileting, things like that. Something that you may also receive with a service from a provider. So say you go to your doctor's office and you're set to get XYZ service or product. If they hand you a form that says ABN, Advanced Beneficiary Notice, this is listing out the items and services that Medicare is not expected to pay for. So this means that, okay, you are going to be receiving the service that is costing you $500. Medicare is not going to pay for it. Medicare is not expected to pay for it. So if you continue with it, just know that you're likely going to pay the entire bill. The Advanced Beneficiary Notice estimates the cost for those items or services, and it'll tell you the reason why Medicare is not going to pay. Okay. Now looking at the Part D prescription drug coverage. So Medicare Part D prescription drug coverage, this is what goes with your, you'll have drug coverage with original Medicare, or you would have drug coverage with your Advantage plan, but it helps cover those outpatient prescription drugs. So everything that if you're not in a hospital, if you're picking it up at the pharmacy, this is your outpatient medications. Your Part D drugs, again, can be standalone with original Medicare or part of a Medicare Advantage plan. You enroll for Part D drug plans right after you sign up for Medicare. So that means after you've signed up for Medicare Parts A and B. And that's one of those things that I tell folks, take one step at a time. When you're first enrolling for Medicare, you have to sign up for your Parts A and B first. And then the next step, once you've contacted Social Security Administration and you've enrolled for A and B, the next step is then to find your drug coverage or your Advantage plan. And then if you step by step, it may, certain prescription drug plans can help cover certain recommended vaccines. For example, the shingles vaccine. I know I saw Kinney's or Walgreens down the road, they had a sign up for shingles vaccines being out. So just something to know and ask your plans too, is what vaccines or shots are covered with my plan. And just an FYI for everyone, all All drug plans must include at least 2 drugs in the following categories. So HIV and AIDS treatments, antidepressants, antipsychotic medications, treatments for seizure disorders, immunosuppressant drugs, and certain anti-cancer drugs unless they are covered by Part B. When I do plan comparisons for folks, there is a section that will tell you specifically chemotherapy is not covered, chemotherapy partially covered. It'll tell you if that, if that's something that you or someone needs. Plans do state that outright. They state that outright. Okay. All right. So now the big question, do I need to do anything during open enrollment? Okay, so open enrollment starts this Friday. Do you need to do anything? Short answer is no, you don't need to do anything if you like your current plan. And as long as your plan continues to be offered the following year without any changes. So that being said, it's important. I said at the beginning, I'll say it again and a couple more times, but compare your plans each year so that you can confirm that it is still the best plan for you. If you don't switch your plan, your coverage will continue into the next year, and you don't need to confirm or inform Medicare or you don't need to make changes, but it's good to just touch base. If your health has changed, even if it's just adding 1 or 2 or taking away 1 or 2 medications, plans change each year, and insurance companies have the right to change their plans every year and their cost and what tier medications they do or do not cover, and so on and so forth. But it's important to just touch base with that every year. Now taking a look at what's new for 2022. And I think this is something that we were all hoping, or at least hoping and expecting, that there are some COVID-19 items covered. The vaccine is covered by Medicare. I know some individuals have called and said that they got their vaccine and they got a bill. Essentially, it was an invoice showing what it would have cost them if Medicare did not cover. It will cover diagnostic and antibody tests, as well as certain treatments. Medicare will cover certain COVID-19 treatments if somebody is inpatient hospitalized. Something that I'm excited about, given my previous professional life when I worked with the Alzheimer's Association, the cognitive assessment and care planning services are now covered with Medicare coming for 2022. So that means dementia and cognitive impairment screenings are now covered, and they are included in an annual wellness visit. And this again is covered by Medicare. And I know that this is something that scares folks, but just like everything else, you want to have a baseline at 65 of where am I now? And even if there's no concerns, 5, 10, 20 years from now, they'll have something to look back at. And it's just so important that we're adding all of these extra services to Medicare and such huge strides. Okay, something else that is covered coming up in 2022 are blood-based biomarker tests, which once every 3 years, individuals can receive the blood-based biomarker test, and it will be covered by Medicare. The individuals being tested are required to be between 50 and 85 years old, showing no symptoms of colorectal disease, and are at average risk for developing colorectal cancer. Something else that I am excited about being added to Medicare for 2022 are risk factor assessments for opioid use disorders. I know we have had the opioid epidemic, especially in central New York and all over the country the last few years, and we've seen this as a even more of a significant problem, but primary care doctors are now required to evaluate and just adjust prescriptions for opioids and making sure that individuals are receiving what is truly necessary for them, for their needs, and just another big stride in our healthcare. Okay, so drum roll, hot off the press this morning, the Social Security Administration announced the increase of 5.9%. So Social Security benefits for approximately 70 million Americans will increase 5.9%. The increased payments will, for approximately 8 million SSI beneficiaries, will begin at the end of 2021. And I was looking into, why the big increase. Normally it's just, last year it was the 1.3% cost of COLA, stands for cost of living adjustment. So last year it was the 1.3% cost of living adjustment. And so this 5.9% increase was tied to the cost of living adjustment and is determined by Department of Labor's Bureau of Labor Statistics. I'm not sure exactly what that meant, but it got me, I was very curious as, how did COVID impact this? We've just seen so much change over the last year and a half. So it's, it's exciting that it went up 5.9%. And I'm just, I'm a curious person. So I want to know, maybe get a little more detail behind it too. Okay, so they slide again for how do I sign up for Medicare? And this might make a little bit more sense now that we've gone through the other parts, or maybe you're even more confused than before the program started. But to sign up for Medicare Part A and B, Part A and B, no matter if you have original Medicare or if you're going with an Advantage plan, you need to sign up for Parts A and B first. And you do this through Social Security Administration during your specific enrollment period. And you can sign up for Parts A and B online at ssa.gov or by calling the Social Security Administration at 1-800-772-1213. Now to touch on a few programs that can help folks, paying for their Medicare. One, if someone is on full Medicaid, then Medicaid will help them pay for their Medicare costs. There is another program called the Medicare Savings Program, which is actually run through the Onondaga Medicaid Office and Social Services. The Medicare Savings Programs has several different levels. For example, if for a single individual, you can make up to, I believe it's 1,426. I don't have the numbers right in front of me, but for 2021, for a single individual, I believe 1,426. And that can help you pay your Medicare Part B premium. There is also the New York State Elderly Pharmaceutical Insurance Coverage. You may have heard this as EPIC. So the New York State EPIC program is another kind of supplement drug. It's a supplement drug coverage that can help you lower costs specifically for your Part D drug coverage. And this is a New York State program. That's something that, I can print out the application and mail it to you. If you Googled New York State EPIC, that would also lead you to their page, and you could also print out the application at home and mail it in. It gets mailed in, or you can fax it to the New York State Office for Aging in Albany. And then there's also the Extra Help program through Social Security Administration, which can help individuals save up to $5,000 a year towards their Part D. So, and there is some information on our website on ongov.net/aging. There's information on all of these programs as well and the different income guidelines. But again, of course, if you have specific questions and you want to connect one-on-one for this, just give me a call and we can chat through it. Okay, so now you have this information and what do I do with it? So really step one was gaining the knowledge of what are the basics, what is the basic information that I need to know. So now, okay, that's where we are now. We know that we need Part A and B. We need to pick between a drug plan or a Medicare Advantage plan. And then looking at, based on your current needs, so not, you and your spouse, just you, what are your current needs and what are my options? When you're signing up for a plan, always ask, when will my plan begin? When will my plan be active? And that's important to know, especially if you have other coverage. You want to let your previous provider let them know that you will be terminating that coverage. You want to ask, am I eligible for cost savings programs? The worst that's going to happen is someone says no, and the best that's going to happen is you might be saving money every month or over the course of the year. And then looking at, okay, what resources are available to me? And that's where I come in, of course, the high cap program. And this is the New York State Health Insurance Information Counseling and Assistance Program. It's a mouthful, but essentially it's just saying that the Onondaga County residents can receive free and confidential appointments. I make no, I don't get commission. I'm not an agent. I'm not selling you certain plans. I really take your information, your medications, your preferred pharmacy, the town you live in, and all of that information, and sort through what is the best plan for you. And again, I stress that even if it's you and a spouse, if your partner, if you have, one of you is on 10 medications and your partner is on 2 medications, you're more than likely not going to have the same plan, and it wouldn't make sense for you to sign up for the same coverage. So always looking at you as an individual. Everyone's health is so different. I get questions often of, okay, just, all right, I want to get this over with. Tell me what's the best plan. And, I gotta say, we have to slow down here, because it's not that simple of a question. What's good for me is not good for you. So we have to really take a look at your health needs and everything. So when it comes time to us connecting, we can look at, is your best option original Medicare or is an Advantage plan? And then from there, looking at Medicare covered costs, what deductibles and copays would be with which plan, how to select and review plans that fit your needs. And if you ever ran into specific insurance problems, you can reach out. So if and when questions arise, please give me a call at our office in downtown Syracuse. We're in the Civic Center building, but we can be reached at 315-435-2362, and then you can press 0 and you will be connected with me. So with that being said, all right.
Okay.
I know.
Well, thank you so much, Taylor.
Yeah.
Kimberly again, everyone. I'm going to leave Taylor on screen for a few minutes. You don't need to see me. But thank you so much. I know this is a lot of information, and people, I'm sure people are still scratching their head going, oh my God. But the good news is that the high cap program exists, that experts like Taylor exist who, look at Taylor. I'm sure you're just dying to call her. Look at that smile. Really? No, she's outgoing and warm and friendly, and it's not a scary thing at all. So, and somebody did ask though, Taylor, if the high cap program is available in Oswego County. I think it's available in every county, but do you know offhand for sure?
Yes, it is it's a New York State program, so it is available in all counties throughout New York State.
Okay, yeah, I thought that's, it's been a state benefit. And yes, Monica, we will be, I believe, we will be, it's okay, right, to provide the PowerPoint presentation, right?
Yeah, of course.
So
Yes.
I'll be sending a follow-up email. We'll send the PowerPoint presentation. I do also plan on sending links to the EPIC program, the Medicare Savings Program, and Extra Help, just so that you have that at your fingertips and won't have to look it up. They're all really great resources that may be able to help you if you're financially limited.
Yes, and I just in the chat box, I just put in the New York State EPIC program application. So so that is in there if you did, if you are on Zoom, but again, Kimberly's gonna send it out as well.
I can send that along as well. I think that's a good thing, just so people, can have an email with this information in it and they don't have to search around for it. So I'll send that out for sure.
Yeah, and then I'm also putting in there the New York State Medicare Savings Program. I just put the link into there, which again, it's run through the Medicaid office. That application can be printed out and mailed into Medicaid, but the information on the guidelines are in there. They're still the same for the last 2 years or so, but yeah.
Okay. Yes, good. So everybody will have that information for either yourself or for maybe a later date or to share with a loved one. So that's going to be good. And I do, and yes, you will be able to watch the recording. I'll have it posted probably not till early next week because I'll do a little editing, especially at the beginning of the program when we had some technical issues. But I do have a couple other questions real quick. We have 7:07, so we have a little bit of time.
Yeah.
The first question is about delaying coverage. So in today's world, I don't know the percentage, but an awful lot of people are working to age 70, or maybe even more. So they might be covered under their health insurance. So if they do delay registering or signing up for Medicare, how are they proving coverage? Do they have to have a form from their employers, or what does Medicare require to prove that they do not deserve a penalty? And they don't deserve a penalty, right?
Yeah, exactly. So a lot of individuals are working past the age of 65, so are denying their Medicare Part B or A and B coverage when at the time of enrollment. So what happens when you first, when you say, okay, I'm retiring in 4 months from now, and what do I do? So there's 2 forms that will need to be filled out, and I don't know if it's helpful for me to tell you what they are now. So disregard it if it causes you confusion, but there are 2 forms. One you fill out, and the other your employer fills out. They provide you the coverage, or really stating, yes, I had this credible coverage. You mail it into Social Security Administration with your application, and then you're good to go. So I would say the most difficult part is making sure that you can connect with your employer for that proof of coverage. So plan ahead. I know you can't always plan ahead, but if you can, try and do it, at least 2 months ahead of time.
Okay. Someone also asked about Medicaid, the Medicaid. I think it's around $17,000 a year, which might be upwards of maybe it's $860 or something to qualify for Medicaid.
Yes, it was.
Is it $861? That sounds familiar to me.
I was gonna say $876, but
$876.
Close.
Yeah, it's definitely above the 600 that you had looked at last time.
Yes, it's definitely above 600.
Yeah.
I'll tell folks, I'll be very transparent. I know the basics of Medicaid and I know how Medicaid works with Medicare, but when it comes to the the big,
Right.
deep details of Medicaid, that's not my area of expertise. So we have plenty of coworkers in our building that are
Yeah.
experts with Medicaid. So, I would reach out to them if you have specific questions, but eligibility
just-
screening wise.
Yeah, it can be complicated. And there's different types of Medicaid, there's
Yeah.
insurance coverage, home health Medicaid, and for chronic care and nursing homes.
Yeah.
So it's a complicated issue. And we'll be doing a class on that in the spring too. So look forward to that
I will attend.
information. And another question, if you don't enroll 3 months prior to, say, your birthday's in June, you don't enroll 3 months early because you don't know, because you haven't attended a class and you didn't call you.
Mhm.
When you do enroll on your birthday month, which is what I would think you would do, that would seem intuitive. So I'm sure a lot of people do that. Then you're not covered for how many months? So did you say that? Am I saying it
Yes.
correctly?
Yep. So if you enroll the month of your birthday, your coverage will not begin until 1 month later.
1 month, okay.
Yeah.
Well, that's not too bad, but okay. However, if you enroll in a Medigap program and you have a pre-existing condition, you did say that there would be a 6-month waiting period. So
Up
do
to
you
6
know,
months.
is that 6-month waiting period for the to have any coverage for the pre-existing condition? Or is that your Medicare plan won't kick in for up to 6 months?
Yeah, so that's a good question, and it's more of a complicated answer than
Of course.
yeah, it's a complicated and it's a good question. It's a complicated answer. So if someone is concerned about, themselves and signing up, we'll connect one-on-one. It's just one of those things. It's complicated, and to give
Okay.
one answer could be misleading for one person where it's the right answer for another. So I don't want to cause any confusion more
Okay.
than I may have already in the last hour.
Okay, so that's a question to ask the expert on, to give you a call on, okay.
Yeah.
And then another thing that you said, which really shocked me, which I never, ever knew, was that if you don't have 10 years worth of work experience, your Medicare premium is going to be pretty hefty. So,
Yes.
so individuals or women who choose to bring up a family and don't have that, their husband will be covered, but they will be paying up to $500 a month for coverage.
For the Medicare Part A premium.
Wow.
Yes.
Wow, that is shocking to me, but I never, ever heard that either.
Yeah,
I'm glad you mentioned it.
Yeah, I had a recent case. An individual worked 9 years and 4 months of their life before turning 65. And they didn't qualify for the premium free.
Wow. Well, that's really something. Never knew that. Okay. And I don't know if you know this or not, but I'm going to ask you. If an individual is in the hospital under observation and not being admitted, Medicare does cover that, but not as an inpatient hospital stay. But are they covered?
Yes, because that will be considered Part B outpatient.
That's Part B outpatient. So they would be covered under original Medicare or probably any Advantage care plan.
So they would be, no matter if you have original Medicare or an Advantage plan, you'll have Parts A and B. So if you're in the hospital for observation, it is outpatient. If you're in the hospital and admitted, then it will be your Medicare Part A.
Okay, Part A is the hospital, right? Okay.
So if it's an observation, it's Part B.
Okay. And then one more question. I want to try and end at 7:15, but the advance beneficiary notice, is that something that an individual can ask for in advance? So say you your doctor says that you need a specific treatment or test, can you ask a facility if, or how, who would you ask for an ABN? Would it be the hospital, the treatment center? You know,
I don't understand the question.
okay. So if you mentioned that a person can get an advanced beneficiary notice to see if you request it, to see if a specific treatment is covered.
Oh, okay. So that's something that's given to you. You don't ask for it.
Okay, so you don't know in advance. You can't find out in advance. That was my question, really. I
Right.
guess.
So yeah, they will, I mean, you can contact the insurance company ahead of time, if you beat them to it. But if you are set to receive a service, for example, I had a woman who was set to receive a certain type of home care therapy, occupational therapy, or some type of therapy at home. And the aide got there, she handed her this form, and it said, advanced beneficiary notice. And so at that point, she didn't know until that moment. And, she's there, she's ready for her appointment. And then, she saw the estimated cost of, the max she might pay for that service. And so she had to deny the service because, at that time, because she, she's like, I'm not signing this form.
Yeah. Yeah, that's, kind of upsetting. It would be nice to know ahead of time. So, and then someone asked a question, and I'm not really sure what this means, what savings programs they were referring to, but they asked, are the savings programs listed as 2019 the same in 2022?
Yes. The link that I sent for the New York State website, it has not been updated, but it is the same from 2019. A lot of insurance companies and a lot of programs have not updated rates since, with COVID.
Oh, of course.
There are a few who have, but several who have not.
And then Joseph said to everyone, a spouse can be covered for Part A on their spouse's record. I don't know
So
how that would work, but
everybody needs to have their own individual Medicare coverage. As we talked about, when it comes time to picking out Advantage plans and drug plans, everyone has different needs, different prescriptions, different medications. When different types of plans, folks need different coverage, even if it is with your partner.
Okay. Okay, so that's interesting. Okay. So those are all the questions I have. I'm not seeing any others in the chat. Let me just look real quick. Just thank you. And thank you all for joining us. I hope this was helpful. And as Taylor has graciously said over and over and over again, I hope you're not daunted, but if you are, she's there. Taylor is there to, talk with you one-on-one and help. So thank you all so much, Taylor. I'll see you soon. Thank you very much. And we're gonna close out the meeting.
All right. Have a good night, everyone.
Good night.